do offer comprehensive services for the family, which you're not going to find at most child care centers and preschools. We have family service workers that are social workers, and then each classroom has a social worker that's assigned to them. You get to know them right away because they're in charge of our enrollment and our registration. So they work with the families to determine which program you're eligible for, what you're interested in. And then once you're enrolled, family service is there, available to both staff and families. If your child needs help with adjustment, then they're there to help with that. If you need clarification on any of our policies or procedures, we can conduct individual classroom observations of children. If a child is having difficulty in the classroom setting. We also schedule parent conferences if you have any concerns, or to discuss your child's progress and or any concerns in the classroom. We're also there to provide counseling and make referrals to community agencies for any support families might need. So that could be anything that your family has a need for. We have great partnerships in the community, and lots of resources that we can make available to our families. As Mary said, we also have nurses. My health staff is made up of 3 nurses, registered nurses, and their offices at our 3 largest sites. So here at Palmer's Hill, at William Pitt, and also at our Maple Avenue location, we have a nurse that's full-time. Nurses are there to assist the teaching staff in monitoring the children's health. All of our teaching staff are trained in CPR and first aid, universal precautions that include procedures for correct diapering and hand washing, and also medication administration for children. So the nurses work close with family services during the enrollment process, to make sure that children have all of their immunizations, that they have a current health examination, and a dental examination. If a child has a chronic health condition, they're there to create an individualized health plan with the family. They also either conduct or oversee the screenings for hearing and vision, which we've done in the past here on site. Also in our infant and toddler classrooms, our nurses conduct a visit once a week to monitor the children's overall health and development. So we consider ourselves very lucky that we do have full-time health staff here at CLC. The last part to program services, which is my group, is nutrition. We have a full-time nutritionist. As Mary said, we serve breakfast, lunch, and snack here, which is all included in your tuition. Parents do not need to send any food in with their child. If your child has an allergy or there's a cultural restriction, you're vegetarian, CLC will make the appropriate substitution for your child. Our nutrition staff develops the menu and works closely with our contracted food service company, Lindley. Lindley actually cooks at our kitchen, which is at William Pitt, and then it is delivered to the outside sites. Most lunches are hot meals, and they're all compliant with the USDA because we do participate in the free and reduced lunch program. But meals here are included in your tuition. Our nutritionist is also available for counseling. We do nutrition growth assessments with children in the fall and in the spring, where we check heights and weights and determine children's body mass index, their BMI. And then we offer counseling to families if needed. Also, we support breastfeeding moms here. So if you do have an infant and you are a nursing mom, um, our staff are trained to properly handle breast milk and follow parents' feeding plans. We do provide a quiet and comfortable space for breastfeeding during non-COVID times. Um, and I think that's probably what's on everybody's mind, right? What precautions are you taking? What are you doing to ensure that my child's going to be safe with you? We've been open well, we've been open since April. We did have a special program here for the months of April and May called Project 26, where we were serving exclusively Stanford Hospital employees and their children here at Palmer's Hill. We've reopened our regular program at the beginning of July. It was actually the end of June 29th. We did put into effect very strict policies and procedures to deal with COVID and to ensure health and safety of our staff and our children. So first and foremost, only staff and children are allowed into our buildings. We are not allowing any volunteers in. We ask parents, we have parents drop off and pick up at the door. And we use multiple entrances at our location so that people aren't lined up in a big line waiting to get in. Our classrooms are on a staggered schedule in order to space out entry and exit from the building. So each classroom has an assigned time to be open. Some classes are open 8:30 to 4:30. Some are, 8:30 to 4, some are 9 to 4:30. There are different opening and closing times depending on the actual site and what our needs are there. And as part of your intake process, your enrollment process, you would talk to the family service worker about what works for your schedule. But parents are asked to drop off and pick up at the door. Our children go through a health screening every morning when they come. So we do have a health survey asking questions of the family on whether they've been exposed. They know anybody who's been exposed to COVID, who's tested positive, who is being tested, or who has traveled. And also we do temperature checks each day at the door.
A lot of this, what Penny is talking about, is because we are licensed facilities. It is required, for example, the health screenings that we do them on a daily basis. But we actually do go above and beyond a lot of what the state requires us to do. Like, for example, Penny was just talking about it with the temperature checks. So temperature checks are not required, but all of our facilities, doesn't matter, children, staff, get their temperature checked on a daily basis.
Also, all the adults in the building are wearing masks at all times when they're on our property. So even parents dropping off and picking up, we ask when you're on our property to wear a mask. Children ages 3 and older are wearing masks now. That is something that came down from the Office of Early Childhood, that's best practice for our children to wear masks. There are mask breaks throughout the day, and if a child's having issues, we're going to work with them individually. But so far, it's been a little over a month since that was put into effect, and our children are doing really, really well. CLC employs a cleaning company that comes and thoroughly cleans our building each night. So that we do have somebody that comes in and does our cleaning daily, including electrostatic cleaning. We can do a deep cleaning when necessary. But in addition, CLC staff are cleaning throughout the day. So any high touch surfaces in the classroom, in our common areas, are cleaned throughout the day. We also have hand washing procedures, which you know, in our business in early childhood, we were doing the whole time, you know. We wash our hands throughout the day, but additional washing is occurring before and after leaving a play area, before and after playing outside, after a child has been comforted, before leaving school for the day are additional times. And the classroom environment has been changed a little bit for COVID. So um, the number of children in the group has changed, so that the Office of Early Childhood has told us that, you know, we should be having fewer children in the classroom. The state is saying we can have 16 to 18. Right now, we have anywhere between 10 and 15 right now in a classroom, and we don't anticipate that changing anytime soon. We used to have up to 20 children in a classroom, so we have significantly fewer children. Um, and we are limiting the number of children in each interest area. So our classrooms are set up into centers. You have the dramatic play area, the block area, the science center, all different centers in the classroom. And so we're spreading children out within the classroom. Toys and materials that we're not able to regularly clean or disinfect have been removed, so that everything that we have in our classroom, we're able to clean and disinfect on a daily basis. Children are spaced out when they're seating. We understand that, you know, social distancing is very important. And all of our children are each part of a cohort, so that a cohort is made up of either one classroom or two classrooms in a cluster. We have at William Pitt a few classrooms in a cluster that are a cohort of children. So staff are assigned to that cohort, and those children do not intermingle with other cohorts. So they do not mix with other groups of children. Everybody has their own time on the playground. They have their own entry and exit each day, so that, you know, we are trying to limit the number of contacts that we have during the day. You know, as we said, staff are also doing the daily health checks, as well as washing their hands throughout the day. During nap time, cots are placed apart from each other with alternating head and feet, so that a child's not face to face with another child. And then outside playtime is also incorporated with staggered shifts as well. Breakfast, lunch, and snack, we used to serve family style. Now we're serving it on individual plates for children. So the teachers prepare the plate of food and then serve it to the children. And then outdoor play, as I said, group times are staggered for outdoor play, but we're trying to get them out as much as possible. Everything we can to keep everybody safe and healthy here, with the assistance of our nurses and the diligence of our staff. Our teachers have been really great.